What would you think if a former Chinese premier at the age of 68 tragically dies of a heart attack while swimming? Now imagine this. This wasn't just any heart attack. This was a heart attack caused by a long history of diabetes, a silent killer that can strike at any moment. The former premier was swimming, a healthy activity, when the fatal heart attack occurred. It's a chilling reminder that diabetes complications can be deadly, even for the most powerful among us. A life cut short, leaving the world in shock. But what does diabetes have to do with a heart attack, you may ask? Well, diabetes, more often than not, doesn't travel alone. It brings along a host of macrovascular complications like coronary artery disease, ischemic stroke, and peripheral arterial disease. These complications are the result of accelerated atherosclerosis, a condition where plaque builds up in your arteries, making them hard and narrow. Let's break it down a bit. If you have diabetes, you're 3 to 5 times more likely to have a heart attack due to coronary artery disease. It's also the leading cause of death in those with type 2 diabetes. Stroke risk, approximately 2.5 times higher for those with diabetes. And it's not just the risk, but the aftermath too. Your level of blood sugar at the time of a stroke can predict the severity of the outcome. Peripheral arterial disease is another unwanted guest that diabetes might bring. It can lead to foot gangrene, 30 times more likely in those with diabetes, and a risk of lower extremity amputation 15 times higher. It's a silent but deadly link, one that we often overlook. So, how can we prevent or manage these devastating complications? Well, the key lies in taking a proactive approach towards diabetes management. For starters, tight blood pressure control is crucial, especially for preventing strokes. The goal here should be less than 130 over 80 millimeters of mercury. Next up is tight glycemic control. This is particularly important for those in the early stages of diabetes without established cardiovascular disease. Maintaining a balanced blood sugar level can significantly reduce the risk of complications. Then, we have the necessity of tight, low-density lipoprotein cholesterol control. The target should be less than 77 milligrams per deciliter. Lowering the bad cholesterol goes a long way in preventing coronary artery disease. Lastly, ACE inhibitors or angiotensin can be an effective treatment option. These medications help relax blood vessels, which can lower blood pressure and decrease the heart's workload. Remember, diabetes may be a silent killer, but it doesn't have to be. It's a fight we can win with the right knowledge and actions. But how can you contribute to this fight? It doesn't take much. A few simple steps can help make a big impact. Educate yourself about diabetes, understand its potential complications, and share this information with others. Health is a shared responsibility. It starts with being informed, then taking action, whether it's improving your lifestyle or supporting research. Start by learning more about diabetes and its complications. Knowledge is power, and together, we can make a difference.